specific drugs that can bring about this. You have different pharmacological interventions of Ayurveda, Siddha and Unani, and the Panchakarma. And there are specific dosha-based diet that are administered. And in that you have to take into consideration the changes that occur, morning, afternoon, evening, night. What type of things, diet you have to take, what is best for that. Depending on your prakriti, you tailor-make your diet. Depending on whether it's a morning, afternoon or evening, you tailor-make your thing. So that is how Ayurveda has a great contribution to bring about the necessary changes to set the doshas into dimension. All these components can be added on into our integrated system. Naturopathy, what is the special contribution? It works in tune with nature, the 5 elements. The fasting component is the key essence of naturopathy, to give rest to the system. And the pranamaya kosha, how do we integrate? What are the features? Yoga, kriya, the kapalabhati, is a wonderful way by which you can cleanse and shape up the pranamaya kosha. Pranayama, the pranic energization technique, to bring balance of prana and to use the power of prana to strengthen the immune system, we do that. In Ayurveda, we look at the nadis, and we have the new instrument, Nadi Tarangani, to measure that. Tailor-make the drugs to set them to balance. Panchakarma also helps in that. What is the contribution of homeopathy at the pranamaya kosha? It's a process of potentization to increase the power of prana, to set right the imbalances. It can give you quick relief and is very, very cost effective. At the manomaya kosha, what is the contribution of yoga? How we bring about gaining mastery over the mind by dharana and dhyana, Om meditation, cyclic meditation, advanced techniques, MSRT, MIRT, and mastery over the emotions, like the bhajans, the music therapy, and the mastering the emotions technique are all useful. The modern medical system has got psychiatric drugs, the ECT and others, to work on the mind through the brain. And Manomaya Kosha Ayurveda talks about the gunas to be harmonized, more of sattva by balancing the doshas. Homeopathy, the 3 dimensions of introversion, extroversion, eroticism to be changed by selected drugs. What about the Vijnanamaya Kosha? Allopathy system has the psychological counseling and the psychoanalysis and psychotherapy, behavioral thing. And in yoga, we have the lecture through which we give the understanding of the yogic concepts. Yogic counseling, which is very comprehensive, very harmonious. Gnana Yoga is the key essence we use here. Vijnana Sadhana Kaushala is the advanced technique we have developed. Emphasis on lifestyle. Ayurveda, understanding of the concepts by lectures. Ayurvedic counseling, emphasis on lifestyle. Emphasis on lifestyle is the key in the whole of Ayush. Understanding the counseling again. Anandamaya Kosha, how do we do that? Yoga helps to silence the mind while keeping awake, not sleeping off. Samadhi is a wonderful tool by which you can get things. Karma Yoga, Anams, Anandamrita Sinchana, the advanced technique we had developed. Ayurveda says, Prasanna Atma Indriya Manaha. You should have good sleep, you should have good rest, and particularly after treatment of Panchakarma, etc., you must do that. Naturopathy also emphasizes on good rest after naturopathic treatment and the good sleep that we have. So these are the basic principles on which we can have the integration. But are there evidence bases? We have been working over the 35 years on yoga therapy research. And we have treated large number of patients, 2 lakhs of patients on bronchial asthma, 25,000 diabetes and others. 470 research papers published, peer-reviewed journals, MS dissertations, PhD 34, and large number of publications we have been able to do that. Diabetes. Our first paper was in tune with the Royal Free Hospital we had, published in British Journal of Complementary Medicine. In this RCT trial we showed that the control group, compared to the control, there is much higher improvements in the yoga group. Even the HbA levels had shown improvement in the yoga group than the control. Then we started the RCT trials, comparison with the standard treatment in multicentric trials. Research finding 2-armed intervention RCT, 277 type 2 diabetes, and 5 zones around Bangalore, random allocation to yoga-based lifestyle one group, another the exercise-based lifestyle and the other. And the results show that the oral hypoglycemic agents have reduced in the yoga group compared to the others. And the HbA1c has decreased quite significantly in the yoga group, as you could see. And the lipid indices also have shown great improvement in the yoga group compared to the control. And conclusion is, the yoga lifestyle program is similar to ELSP in reducing FPG, HbA1c, triglyceride, cholesterol, VLDL. But YLSP is better than ELSP in decreasing oral hypoglycemic medication requirement and LDL and increasing HDL. That's the key essence that we have found. What is the hypothesis testing of Adi Vyadi concept? Concept is when you reduce Adi, Vyadi is going to reduce, we say that. So we started doing that, and in this simple study on 129 patients we see when the Adi as measured by PPC, SRAS and BRS have reduced, then all the parameters of Vyadi also have reduced. Symptom score, medication score, FPS, PPS all have reduced. Therefore, the hypothesis that when you reduce Adi, Vyadi reduces is brought forth here. Then we went to the mechanism of the study. What is the speciality of yoga for diabetes? It is the stress reduction to remove the confusion of the immune system. What is the confusion of the immune system? Somehow the immune system thinks that insulin is my enemy. Therefore, when the insulin is coming up from the beta cells of the pancreas, it doesn't allow that to go to the bloodstream. Why this confusion? We know it's all due to stress. And therefore in yoga, we reduce the stress hormones by giving very deep rest to the system. And we have the new method for deep relaxation and stress relaxation by cyclic meditation. The amount of rest that you get in 35 minutes is 32% compared to a good sleep for 6 hours, which can give only 9% rest. Therefore, when you give deep rest to the system, the stress reduces. And the psychoneuroimmunology shows when the stress reduces, autoimmunity reduces, and it brings about the restoration of the immune system normalcy. Oncology. Studies on breast cancer. Exploratory phase, pilot studies, RCTs, and mechanism studies we started working on. 20 years of our therapy research started off way back in 1986 when we had terminal case cancer patients who were almost declared dead. But once they started coming to the yoga classes, 2.5 hours, I remember Dr. Nagarathan, we were taking classes, they all started improving. And many of these people are still alive today, imagine. This enthused us to take up our pilot studies in Kidwai Memorial Institute of Oncology in 1987, and we went on to go to the controlled trials and breast cancer, a 3-year study, and secondary effects on yoga on cancer cervix. And people started coming to our Arogya Dham here, and they started getting wonderful results. The symptom score started reducing, and they started improving. That led us to have rigorous control trials, RCD trials, and effect of IAYT on breast cancer undergoing radiation, chemotherapy, and surgery. And we have a number of publications now, almost 15 to 20. These are some of the examples of the publication that we have done in big journals. And here we have been able to show that influence of yoga on diurnal salivary cortisol levels, effective states and quality of life in breast cancer subjects undergoing adjuvant radiotherapy, used as an adjuvant. That's important. You could see that the hospital anxiety scores have reduced in yoga, depression have reduced, the perceived stress scores have reduced, and all positive effects of yoga compared to the non-yoga groups in that you have seen, and the cortisol level. Therefore, yoga is adjunct to conventional cancer treatment in breast cancer is very, very useful. We have been able to show in Bangalore Institute of Oncology, and this is the full detail of our study that we have measured, hematological studies, biochemical studies, and the serum IgG immunological parameters. We all showed that there has been a lot of improvement during these dimensions. Statistical analysis has proven that the results are very, very useful. Anxiety trait scores, depression, the number of scores, these things have shown that yoga scores much higher compared to the normal things that we have. Therefore, in conclusion, that we have been able to show that reduced affective states, anxiety and depression, improved quality of life, reduced treatment-related symptoms, severity in distress, and during chemotherapy, improved quality of life, reduced affective states, then reduced treatment-related things, reduced post-chemotherapy, reduced decrements. In conclusion, we have shown that the integrated yoga program is useful in reducing psychological morbidity, treatment-related symptoms, improving quality of life, and immune cell counts during this thing. With that, we went further to our collaboration with MD Anderson Cancer Center. As many of you know, we have a big study going on 600 patients of breast cancer in a 3-arm trial. And then we started developing the advanced techniques, and these are called the PET, MSRT, MIRT, MEMT, to work at different levels. And essentially they are used to use our Prana Shakti, Mano Shakti, Ichha Shakti, intellectual Shakti to strengthen our immune defense. And confusion of the immune system, thinking that cancer cells are my good friends, had to be reduced by stress reduction. And stress reduction reduced this confusion, and we started using that control trials in which we have been able to show when you give deep rest to the system, then it's going to blossom and the confusion goes away. Can yoga handle terminal cases? We worked on that. At metastatic breast cancer, yoga and non-yoga, we have shown that the immune system blossoms and the DNA repair mechanisms improves. Studies on apoptosis also have shown there is improvement. And then comparison of long-term practitioners of yoga among cancer patients, NF-kappa B has been shown to improve with the yoga group. Then cardiovascular ailments, we have worked on hypertension and ischemic heart diseases. Within just 4 weeks, the diastolic, systolic blood pressure can come down significantly. Reversing the heart disease, Dean Ornish's wonderful work has been thing, and then we also have similar results in reversing the heart disease in thing. Then we took up to find out the efficacy of yoga in patients with CAD. And in this, we have been able to publish our paper in Elsevier, original article, yoga-based cardiac rehabilitation after coronary artery bypass. They have undergone coronary bypass, then what happens? 1-year result on various dimensions. And we have been able to show with our work in Narayan Hridayalaya that we use the intervention, and the results show that the BMI, changes in body mass index, has been shown to improve significantly, and changes in total weight, ejection fraction improved significantly, and LVEF also has shown improvement, and hemoglobin has improved in the yoga group. FPS, triglycerides, HB, FPS, triglycerides, medication started coming down, LDL medication is reduced. In conclusion, this 1-year prospective randomized 2-arm trial on 300 patients who underwent elective coronary artery bypass, graft surgery for coronary artery disease, CAD, showed the following results. Mental health. Anxiety neurosis can be handled very effectively by using yoga. When Adi reduces, Vyadi reduces is what we showed. Here we showed the different types of pranayama, and Nadi Shuddhi is the best we have shown. Done 4 times a day is the best practice for anxiety we have shown. And mental retardation, slow learners, yoga will be very, very effective, and we measured the IQ levels by Binet Comet test, Sigmund Freud board, and Weinstein social maturity scale, published in these things. Then can we prevent the mental retardation? Our Shamantakamani showed that yoga for IUGR is for prevention. So research, yoga relaxation technique, increase the umbilical blood flow. That is what we have found through the mechanism study. So evidence-based yoga research, total rehabilitation can take place by using this. In conclusion, we can say the scope of yoga for NCDs are quite well recognized today, with the integrated approach of yoga therapy holds great promise for modern NCD. We started with Ayurveda research. So here we started developing an inventory to measure the tridoshas. And how to do that? We use the standard psychological methods to do that. And we took the ancient texts and we culled out all the information that is available there. Item reduction was carried out, by deleting the repeated items, ambiguous items, and by selecting those items specifically suited for children. 155 items in Sanskrit and translation in English were presented to 10 Ayurveda experts. They were asked to judge the correctness of each statement and to check whether any of them was repeated or if any item should be added. Whether the features of Vataja, Pittaja and Kaphaja Prakriti selected for the scales are correct. If the items constructed represented acceptable translation of the Sanskrit also was checked. 147 items were finally retained. As per their suggestions, some of the items were changed and refined, and out of these things, we found that the personality inventory was framed and developed. The scale was again presented to 10 Ayurveda experts and 3 psychologists who reviewed the format of the scale and recommended a 2-point scoring. This was adopted in the final ACPI. Suggestions in phrasing the questions were incorporated. 158 questions agreed by all Ayurveda experts and psychologists were incorporated. Initial scale was answered by parents of 60 children. Item difficulty level was analyzed. The items which showed difficulty level between 0.3 to 0.8 were retained. And the final ACPI was 135 items, with 45 items for Vadaja, 44 for Pittaja, and 46 items for Kapaja. And this was answered by the parents. A second inventory called Charaka Child Personality Inventory was developed, which is a self-rating scale by the children, with 77 questions. For the pilot study, we used pre-post design, randomized controlled trial RCT design, for personality development camp study pre-post design. Development and initial standardization of the scores were all done, and we used the split half and Cronbach alpha test, Pearson correlation coefficient, and the factor analysis were also made. And the reliability and other dimensions have been put finally. And we want to test whether the Nadi Tarangadi new instrument that has been developed by Anirudh Joshi has the one that can really measure the Vata Pitta Kapha at all. So Nadi Tarangani data was compared with the data from the latter. Good correlations were found. Therefore, conclusion was Nadi Tarangani measures the 3 doshas effectively. This is how we have started working on that. Similarly, we now want to standardize the protocols for different ailments from our Shastras, from the 18 different Shastras of Ayurveda. We bring forth and put them together and develop the protocol in a very standardized way and do the clinical trials and do the mechanism study. And the methods from Ayush, we have to call out and then see that whether can give immediate benefit to the people. We all know the acupuncture and some of the things like Lagupashanka Prakran for DM can all help a lot. And we have to develop new diagnostic techniques which can help in the pre-diagnosis of cancer, diabetes and others. For that, the Nadi Tarangani is very good, and Pranamaya Kosha can be measured by the GDB and the echograph, which can help quite a lot. Medical astrology is another area we started working on, which can help to see what is happening in future and what are the innate blocks that we have, which can be worked through. Similarly, the role of Vastu is also of importance, whether it can help in improving the disease alleviation and can it prevent. And this is how the integration of the allopathic system with our ancient wisdom base can be brought forth, and we have to go a long way before we bring this integration, but we started doing that in our Arogya Dhamma from the last 3 years, and Dr. Nagaratna is going to present later how it has shown much better benefits compared to doing only yoga and modern allopathic system. With this, I once again thank our organizers for giving me this opportunity to share some of the basic thoughts that are needed for this integration of modern medical system with the Ayush and the challenges that we face. Dhanyavad.
Thank you very much, Guruji, for your talk on integrative medicine. We have with us Professor Andrew Bolton, who is the chairman of the postgraduate education of the European Diabetes Association, and honorary secretary and program chair for European Association for Study of Diabetes for last 5 years. In addition, he has very strong links with the American Diabetic Centers. He is currently the professor of medicine specializing in diabetes at the University of Manchester and consulting physician at the Manchester Royal Infirmary. He has published over 300 papers in peer-reviewed journals and holds major multiple grants. Andrew sir has received, he's the first awardee of the International Award into Diabetic Food Research in 1995, has received the Casli Pedroli Award from the European Association for Study of Diabetes in 2003 and Roger Pecoraro Award from American Diabetes Association in 1996. More recently, he was awarded in 2005 by Edward Olmos Award for advocacy in prevention of amputation of diabetes. He is the former editor of the Diabetic Medicine between 1991 to 1995, and currently is an associate editor in the Diabetes Care, which is the leading journal on diabetes. I request Dr. Andrew Bolton to kindly give us a talk on diabetes, the epidemic of 21st century. I welcome you, sir.
Dhanyavad. And bonjour, muito obrigado to our chairman. It's always a pleasure to be in India, a wonderful country that I first visited some 31 years ago. And I've been back here many times,